and thank you so much for joining us today for our third Facebook Live during our Breastfeeding Basics series for World Breastfeeding Week. My name is Gabby, and I am joined here with Dr. Alexis Sawyer, who is a board-certified pediatrician at Boys Town Pediatrics. Today we're going to be talking all about latching when it comes to breastfeeding. So if you have any comments on or questions on this topic, please feel free to leave them in the comment section of this video, and we will get them answered at the end. Also, if you haven't entered our giveaway, we are giving away different items every single day this week for World Breastfeeding Week. So go ahead and fill out the RSVP link that is above this video, and I will also make sure to leave it in the comment section. All the winners are going to be announced Friday in the Breastfeeding Basics Facebook event page. Awesome. So Dr. Sawyer, how are you doing today?
I'm good, Gabby. Thanks for having me, and happy Breastfeeding Week.
Yes. Well, we really appreciate you hopping on. So let's get right into the questions here, all about latching. So what, in your opinion, do you think moms should know about latching before their baby arrives?
I think it's important that moms understand that latching is important. It's one of the foundations of good, effective breastfeeding. And it's important to get latch right so that your breast will hold up through breastfeeding. It's also important to latch your baby correctly so that you will be stimulated to produce enough milk. Mm-hmm. And then last but not least, it's just important to have good latch so that your baby gets enough milk and has the proper nutrition. I think it's also important just for moms to set appropriate expectations and know that they might not get that latch right from the get-go. Mm-hmm. And there are people around to help them with that. So just to have just some realistic expectations.
Yeah, definitely. So when it comes to getting a good latch, what tips do you have?
So I think there are multiple different things that will help you accomplish like a strong, healthy latch when breastfeeding. First of all, I think it's just important to make sure that you feel comfortable when you're trying to latch your baby. Feel like you're in a position that is comfortable for your body after you've had your baby. It may be different for a mom who's had a vaginal delivery versus a C-section. But know that it's just important that you feel supported, that you have good back support, arm support, and that that's just a good thing to start with. The support, I mean, some people will just use pillows for support of their baby. Some people will get fancy breastfeeding pillows. They all kind of do the same thing. People really like the Boppy pillow or the My Breast Friend pillow. But once again, you can just use pillows that you have at home to help support as well. I think another important thing to get a good latch is just to always remember to bring your baby to the breast versus bringing your breast to the baby. Because that way you just allow just a better position. You're not usually leaning forward more. And then when you have to let go of your breast after the baby latches, that you don't have some separation between the breast and the baby that way. Mm-hmm. And then the last thing, I think something to keep in mind is to look for your baby's cues of hunger. And if they're playing around their mouth, if they're moving their lips a lot, or if it's been a while since they've fed, try to latch early. It's harder to latch when your baby's upset and just ravenous. It's just harder. It's stressful. It makes it more of a hurried task to do versus something that you can take your time to get right. Mm-hmm. And then I think another good thing is just trying to have someone around that's experienced in breastfeeding can be a good thing to just have in order to get a good latch. So whether or not it's a nurse, a family member, a lactation consultant, somebody who's experienced to just help that start the right way.
Mm-hmm. Yeah, definitely using resources, I think, is great advice. So what can mom do if the baby is struggling to get a good latch?
I think in the same vein is asking for help. I
Yeah.
think, if you're working at it and you just feel frustrated, something doesn't feel right, it's painful, it's just really important to ask for help. It's different when you're the person trying to breastfeed the baby versus somebody watching. And sometimes when you're in it and you're doing it, it's really hard to kind of reassess what's going on or look outside of, what you're doing at that very moment to kind of troubleshoot. So having somebody to help you troubleshoot um, can be a big part of that, I think. And once again, it can be nursing, it can be a lactation consultant, it can be a pediatrician, it could be a family member that you trust or has breastfed before. But I think that's just what everyone needs to be prepared to do, is ask for help.
Mm-hmm. Definitely. There's no shame at all in asking for help, especially when it
Definitely
comes to
not.
your baby.
Definitely not. Yep.
Yeah. So, what can moms do if they are feeling nipple soreness or pain due to latching?
It's a pretty common problem. And knowing that, especially if it's your first baby or if you have inverted nipples, which some people do, initial latching can be a little uncomfortable, but it shouldn't be sending you through the roof uncomfortable. And I think making sure that that latch is appropriate and it is you have your correct latch will help prevent that. But if you're feeling the soreness or pain, one thing I have is making sure moms are using some sort of nipple cream or emollient like a lanolin.
Mm-hmm.
Also something that I actually heard about after I had breastfed all my kids, but really wished I had known about earlier. There are some gel pads that you can put in your freezer called Soothies that you just slip in your nursing bra, and you can put on after you've been nursing, and it just helps with the inflammation.
Mm-hmm.
Um, let's see. And then the last thing is very important thing to try to keep from nipple soreness or pain or keep it from getting worse is just to make sure that you know how to delatch your baby from the breast. If you have your baby on and you don't have a correct latch, or you're done with that side and the baby's still on there, you need to really make sure you release that suction. And the best way to do that is to take your pinky finger and put it in the corner of the baby's mouth, and you'll feel that release of suction. And then it's safe to delatch. If you don't do that, you're going to set yourself up for, cracked nipples, bruising, things like that. Um, and I guess I should just go over what I think is important to look for a good latch. So if you're feeling breast, pain, soreness, you're having cracks, things like that, just make sure that when you're looking at your baby getting on the breast, that the baby's mouth is open at a wider angle. We don't want it to be closed like this. We don't want just the nipple in there. You want to get as much of the areola in the baby's mouth as possible. So when you stimulate your baby, to try to latch, if their mouth isn't open fully, you can touch your nipple to like their nose or their chin, and oftentimes that will just automatically stimulate your baby to open their mouth real wide. And
Mm-hmm.
then you put your baby to the breast pretty quickly and try to get the benefit of that mouth being open very wide. And so just making sure that you have that good open mouth. A deep latch will help save your nipples from the cracking, the bruising, and all the trauma. And then just reassessing that if you feel like you are having those things happening.
Yeah. Are there any certain brands of nipple cream that you would recommend people look for?
There are so many out there. Some people like to stay away from lanolin, some people don't. I think just find something that you like the reviews, or
Mm-hmm.
somebody in your family or your lactation consultant has recommended. So,
Yeah.
yep.
Cool. I am seeing a couple questions being left in the comment section, so just know we will get to those at the end. We have about 3 more questions, so if you're watching and you have a question for Dr. Sawyer, now is the time to comment and we will get them answered very soon. Okay, so in terms of partners, maybe if mom is struggling to get a good latch, how can their partner support them during this process?
I think number one, we want our partners to be encouraging. So
Okay.
we need a good cheerleader,
Right.
somebody, if you're not feeling good about things, to tell you it's okay, to take a deep breath. I think it can be helpful for a partner to take the baby and let mom get repositioned
Yeah.
and help them get in a comfortable position so that once again you can try over. It's also helpful because once again, when you're breastfeeding your own baby, you're kind of in the middle of it and you don't have the best view sometimes about how baby is actually going on to the breast. To have that person look and see if they see anything that they can help you constructively do differently. But once again, we like constructive criticism and we like lots of good cheerleading. And so that's what a partner should be there for. I think also just being able to help you with pillows, positioning, once again, those types of things.
Definitely. Okay, and then you were just talking a little bit about positions. What did you think, maybe in your experience, was the best position to get a good latch? Because I know there's the cradle hold and the football hold. What would you recommend?
So there are a lot of different holds. You can look online, and there's some pretty creative ones actually. The most common are going to be your cradle, your cross cradle hold, which will be more across the body, obviously, and it's different just hand positionings between the cradle and the cross cradle. And then the football positioning, which is kind of just the baby's tucked under your arm. And then there's also a sideline position where if you're laying down, you can nurse your baby lying next to you. There's also a reclining position, which is oftentimes your first position after you give birth that, nurse will put your baby on your chest. And that's when you're first going to get that latch. It just depends on the mom, honestly. So it depends on how large your breasts are. It depends on if you just had a C-section. It depends on how comfortable you are sitting in a chair versus reclining. If you're having back problems, some of these may not be good ones for you, and doing like a side lying may be better. So I think every mom is going to be different, and I would recommend just kind of trying all of them out as you get your breastfeeding going to see what's most comfortable for you and feels like it's most comfortable for baby too.
Great. Okay, so before we get to our questions in the comments, do you have any final tips for latching?
I think knowing that it's a learning curve, and it's a pretty steep one. Once you get it, you generally have it. But just knowing that it can take some trial and error, and you might get discouraged at first, and that's all normal. I tell moms it's perfectly reasonable to feel like you don't have this all in sync and all together and everything's perfect until you're a couple weeks into breastfeeding. So just knowing that it's a process, and once again to ask for help and don't get discouraged. I think that's key.
Yes. All right, let's move over to the comments here. So the first question is, how do inverted nipples affect breastfeeding? Is there anything different to do?
So I unfortunately had an inverted nipple when I was nursing my first child. So I definitely had some nipple cracking, I think. And my OB kind of warned me, like before I had my baby, that was going to be maybe a little bit of a hurdle for me. There are, they're called nipple guards or breast guards or something like that. They're kind of a domed plastic device that have a flat side with a hole in the middle that you can wear in your bra to kind of train your nipple to come out. And you can find them in stores. You can find them online too. And they're good and I would wear them in between breastfeeding to try to train that nipple just kind of be out a little bit more. Yeah. You can also, it's kind of uncomfortable for people, but to talk about before delivering. But if you feel like you do have an inverted nipple, is just trying to find ways to stimulate your nipple and stretch it out to be out. And just preparing it for breastfeeding that way. And then I think people with inverted nipples should know that it's perfectly possible to get a good latch. It just might take a little bit of extra work. And then knowing that it's really important to treat your nipples right with like your lanolin or your nipple cream. And then also, if you are having pain, to ask for help and use it in some sort of anti-inflammatory icing device would be good too.
Awesome. Okay, the next one is I have a pimple that I have been trying to get out, but it keeps coming back. So I assume it's around the breast region. Will
Oh,
it affect my breastfeeding?
it should not unless it's very painful to put the baby near it, or if it is uh, it affects your milk duct. Sometimes you can notice that something that looks like a pimple, it kind of depends on where it is, but it could be a little bit of a clogged milk duct instead. So, I mean, if it's an inflamed pimple or if it's an inflamed milk duct, what we would recommend is doing a warm pack and seeing if we can get it to drain on its own. Um, but yes, having a pimple near the breast shouldn't bother anything with breastfeeding. It's not harmful to your baby. It just might be a little tender for you.
Good. Okay, going back really quick, we had a follow up on the inverted nipple question.
Mm-hmm.
So this one says, would it be a good idea to train an inverted nipple pre birth?
I think so. I mean, if you have that, we like to plan. So
Yeah.
if you feel like you do have an inverted nipple, I mean, you can talk to your OB about it too. But I think it's not a bad idea to work on trying to train it within your comfort to be a little bit more out, just so it makes it easier when baby's trying to latch that first time.
Yeah,
Good
definitely.
question.
Okay, and then looks like we have one last question. So Allie is asking, my baby has been latching great, but was very fussy during the evening. Would latch for the baby would latch for a few minutes and then pull away screaming. Any advice?
There's a couple different things that could be from that. If it's just a couple minutes of latching, sometimes they'll get kind of mad if you have a pretty good letdown at that period. So, kind of knowing your breast, if you feel like you have all of a sudden an excess of milk at a certain point, sometimes babies will pull off because it's like they get this gush of milk and they're
Yeah.
not super happy with it. So one thing you can do to try to help that is you can actually put a little pressure on the top of your breast to kind of delay a little bit of that letdown if you can predict when it's going to happen. It's
Mm-hmm.
kind of hard sometimes. The other thing to know is that evening time is when babies tend to be more fussy anyway. So it
Yeah.
may just be that they're having a little bit of that nighttime fussiness. And if they're refusing to go back on the breast, then I would, do the typical stuff we do to try to soothe their babies, burp them, rocking, doing some white noise, swaddling, that type of stuff to see if you can get them to calm down. And if they still seem hungry, then you can retry.
Mm-hmm.
But just knowing that it either may be due to just the nighttime fussiness, or it could be due to just a larger letdown of milk at that point.
Yeah. Great. Awesome. So if you are not watching live and you have a question for Dr. Sawyer that you would like answered about latching, feel free to go ahead and comment it on this video or send our Facebook page a message, and I am happy to pass along the question and get you your response. For everybody watching, thank you so much for tuning in. Dr. Sawyer, thank you for your expertise. I know this helps alleviate a lot of stress when it comes to latching for new moms or moms that are expecting. So we really appreciate it.
I'm happy to be here. Happy breastfeeding.
Yes. And make sure you join us tomorrow. We will be live at noon again with Dr. Annie Zimmer, and we're going to talk through common breastfeeding problems. So, going a little bit deeper on the topic tomorrow. So, if you have questions for that, again, let us know, and we will see you tomorrow. Thanks, everybody.